Good morning and hello, everyone. My name is Brandie Bentley, and I am an assistant professor in the Department of Family Medicine, and I'm also a former postdoc with the Center for Disability Health and Wellness. I'm super excited to be in virtual community with each of you today and excited to kick off our presentations. And want to thank you for joining me this morning to learn more about this important work. Today's presentation is entitled From Data to Dashboards, Insights from the Behavioral Risk Factor Surveillance System and the Disability Data Dashboard. So here's what we'll briefly cover today. I'll talk a little bit about why accessible disability data matters. I'll present some brief national data that tells us about disability in the United States. And then I will spend the majority of today's presentation providing a short demonstration of our new disability data dashboard. So people with disabilities often face significant barriers to high quality healthcare. And when those experiences intersect with age, race, ethnicity, gender, and other social demographic identities, these gaps can grow even larger for certain subgroups. So, although data on the health and healthcare experiences of people with disabilities is being collected, a lot of national data is difficult to find. It's really hard to interpret, and it's even more difficult to share. So, that makes it very confusing and inaccessible to many of us. And so, our goal with this project was to develop a public interactive dashboard that makes disability data a little bit clearer, more interactive, and more inclusive. And so that way, anyone, including advocates, community members, researchers, policymakers, and many of us who are here today can use it to explore, summarize, and share disability health and healthcare information. So our dashboard includes information about US adults with and without disabilities based on data collected from three large nationally representative public health surveys. And that includes the Behavioral Risk Factor Surveillance System, also referred to as BRFS. For today's presentation, I'm going to focus on the BRFS survey and the first dashboard that we've launched using the BRFS survey. So this data from 2016 to 2023 includes over 3.5 million adults across the United States. Across the public health data sets that we've selected for the dashboard, disability is defined using the American Community Survey's definition, which includes self-reported difficulty in one or more parts of daily life. And that could include cognition, hearing, vision, mobility, self-care, and difficulties with independent living. When we analyze data from 2016 to 2023, we see that about 1 in 4 US adults, or 28%, report having at least one disability. So that represents millions of people, including ourselves, our family members, our neighbors, our coworkers, community members, and more. And this number reminds us that disability is part of every community. When we take a closer look, we find some clear differences across groups. So when we look at disability type, cognitive and mobility disabilities are the most prevalent among US adults. When we examine age, older adults experience disability more often. About 43% of individuals 65 or older report having at least one disability, compared to 22% among young adults. When we look at differences by racial ethnic groups, non-Hispanic Black and Hispanic adults report disability at a higher rate compared to white and multiracial other groups. And then when we look at sex differences, women report disabilities slightly more often than men within the survey. And these patterns highlight why it's important for us to take a closer look at disability with other identity characteristics because our experiences are not all the same. So with the interactive dashboard, it gives us the opportunity to explore those differences by groups, track changes over time, and look at health topics all in one place. And so with the dashboard, you don't have to understand spreadsheets or have advanced statistical skills. You don't need to know how to code. The information is presented and already done for you. And we really wanted to design the dashboard with everyone in mind. So we were thinking about potential uses amongst advocates, community members, researchers, and providers so that the information is usable and valuable to all. This is just a brief highlight of the data sets that we've selected to include in the disability data dashboard. As I shared earlier, today's presentation is going to focus on our first dashboard using the behavioral risk factor surveillance system, but we also have a dashboard in the works using the medical expenditure panel survey. And we're also looking to include the National Health and Nutrition Examination Survey. So I just wanted to briefly share these and highlight that we're looking at valuable data that can be used to understand disability health and healthcare disparities from different angles. So we want to make sure that we're including metrics on health outcomes, chronic health conditions, the use of preventative services, utilization, expenditures, insurance coverage, and more. So the highlight of today's presentation is taking a closer look at the disability data dashboard. And I have a few screenshots of different components of the dashboard throughout for the remainder of the presentation. And so on this slide is a screenshot of what the dashboard homepage looks like when you open it. It has a very clean layout where it provides a short paragraph explaining that people with disabilities experience major health disparities. And below that is a statement defining the goal of the dashboard. I'm going to also include a link to the dashboard in the chat for those who may be interested in looking at it. I think I can put it in the chat. We'll see. If someone could put the link in the chat for me, that would be awesome. For anyone who's interested in walking through the dashboard live at the same time as the presentation. So at the bottom of this page are the buttons that allow us to navigate to the different dashboards. We have the birth survey, the MEP survey coming soon, and we also have a button highlighting some of our statistical briefs. So I just wanted to make a quick tangent to highlight our statistical briefs. These are very concise summaries of findings from the different data sets that we've had our graduate research assistants develop as we've been working on the dashboard. They go more in depth into different topics that may not be reflected in the dashboard. And so depending on student interests, we've had students explore mental health status across disability types, the prevalence of depressive disorders among LGBTQ adults with disabilities, the prevalence of mammogram and cervical cancer screenings among adults with different numbers of disabilities. And we've also had a brief on racial ethnic differences in arthritis diagnoses and types. So this is a really great learning opportunity for our student researchers who are interested in diving deeper on specific topics related to their interest, and they're able to put out a few page brief talking more about those data and results. And so today we'll focus on looking at the birth survey dashboard. These are some of the key components of the dashboard. At the very top, the title bar displays the dashboard name, which lets users know which data set the data is being pulled from. On the left-hand side of the page, there's a menu panel where users can select health measures, demographic categories, disability types, and the years that they're interested in exploring. The legend below that explains the color coding as the chart dynamically changes depending on what options you select. We've also included some footnotes at the bottom of the visualization and on the left-hand side to provide additional information regarding the data and the selected variables. The main display in the center shows the results as an interactive bar or a data table, depending on which option you select to view. We also have a user guide that provides instructions, frequently asked questions, and more details about the methodology used to develop the dashboard. And then finally, at the bottom, there are export tools that allow users to download the charts and tables as an image, an Excel file, a PDF, PowerPoint, or a Tableau workbook. And so looking at the different options we can adjust for, starting with health measures, you can select from a variety of health measures. And in the example shown on the screen, this one is mammogram in the past 2 years. Once you select your health topic, you can look through the demographic categories, and this allows you to break down the data by ability status, age group, race, ethnicity, or sex. And so, for example, on the screen, it is comparing adults with and without disabilities by selecting ability status. You can also explore the data by disability type. You can filter for looking at all the disability groups together, or you can exclusively select cognitive, hearing, mobility, or vision disabilities. And this makes it easier to see, for instance, how many people with mobility disabilities might differ from those with hearing disabilities on certain health measures. And so for this example that is on the screen, I've selected to view all 6 disability types together. The dashboard also includes multiple years of data. So you can choose a single year, like I've done for the example, just selecting 2016, or you can view multiple years together. So if you're interested in looking at 2016 through 2023, when you select those boxes, the chart will update instantly, reflecting those selections. And so here's an example of the results that may be populated. For this example, according to 2016 data of individuals aged 40 years old or older who have had a mammogram in the past 2 years, 68.69% of adults with a disability had a mammogram, compared to 74.66% of adults without a disability who have had a mammogram. Any disability is reflected in the tan bar, and individuals without a disability is reflected by the blue bar. We also have the ability to see the percentages above each bar so that you always know what prevalence you're working with. You can return to any of the menus on the left to change the health measures, demographic categories, disability types, or years, and the chart will automatically update to show new results. So here's another example, this time for diabetes. I selected to view results across racial ethnic groups, exclusively for individuals with a cognitive disability. And so when we examine the results of this new table, based on the births data from 2016 to 2023, The percentage of individuals with a cognitive disability who reported ever being told that they have disabilities is as follows. We see about 22% of non-Hispanic Black individuals with a cognitive disability report being told they had diabetes, compared to about 19% of Hispanic individuals, 15% of non-Hispanic white individuals, and 17% of individuals who are non-Hispanic, other, or multiracial. And so this chart shows us how outcomes vary across the intersection of disability type and race ethnicity. You can also view the results as a bar chart or tables, whichever is easier for you to read and present. The icon in the top left corner will toggle those results between the different views. So when you click that, it changes that bar chart into a table. And the table provides the same information as numbers for easier reference. There's also an option to export and share the visualizations and tables, and this can be done so as an image file, Excel file, PDF, PowerPoint, or a Tableau workbook by selecting the icon on the bottom right. And these are just two screenshots showing what that output as an image file looks like. And so as example through today's presentation, it works really nicely with PowerPoint. You can populate the images as charts or tables and then directly copy and paste them into your presentation, reports, or research briefs, whatever you're creating, and they're already formatted and color-coded for a nice display. And then lastly, I just wanted to also include a snapshot of the user guide by selecting the user guide button in the top right corner on the dashboard in the box that says questions. It will take you directly to the user guide that we've built into the web page. This presents some frequently asked questions, helpful tips for beginners, and maybe even some resources for experts or those who are interested in learning more about the methods behind the data. And that's all I have for today's presentation. So thank you all. Feel free to leave any questions in the chat. I'm not sure if we have time for questions, but I will pass it back.